So what happens after your procedure? Well, straight away, as the effect of anesthesia begins to wear off, you might experience some pain along the pelvis. This is to be expected and can be managed with different varieties of pain medication, unless of course the pain is severe, in which case you should seek emergency medical attention. Now, things should usually settle down within the next 1 to 2 weeks after the procedure. Some women might experience some degrees of cramping, there might be some degree of bleeding. Some women have also repeated a mild degree or even moderate degree of fever. Complications like infection from having the cannula introduced into the femoral vessel. So with any complications, speak to your medical practitioner, but in the majority of cases, these are mild problems that settle down within 1 to 2 weeks following the procedure. In most well-established facilities, the woman may stay on admission for a couple of days, after which she's discharged to complete her recovery at home, and usually within a couple of weeks you should be able to return back to normal function. What happens to the fibroid itself? Like, the purpose of injecting this embolic chemical is for the fibroids to eventually shrink and die. It is thought that this process happens gradually, so the text and the research suggest that it can take anything up to 6 to 9 months. However, there have been some reports from some women who experience an improvement in their symptoms within 3 to 6 months of having had the procedure. So I've tried to describe it as simply as possible here, but uterine artery embolization is quite a complex procedure, and it should not be carried out by anyone who is not experienced in it. So first of all, they're not just a radiologist, they are an interventional radiologist who has had years and has experience conducting these procedures both under supervision and then on their own to acquire the required skill to be able to manage the procedure effectively and safely. So here's a good place to take a break, and I'd love to hear from you in the comments. Have you had a uterine artery embolization in the past, or do you know somebody who's had this procedure? If you have, share in the comments what your experience has been. So we've looked at UAE, what it is and how it works. Is there anybody who cannot have uterine artery embolization? Well, generally there are only a few exceptions. It appears to be suitable for most women, but there's some women who would just not want to have it done, and that's fine, that's preference. But another important category of women is women who may be allergic to any of the components that are going to be used, particularly the PVA chemical. So these are the category of women who this procedure may not be appropriate for. But generally it has been found to be safe for most women. Of course, as with any other procedure, it's important to be aware of your past medical history and allergy status. This needs to be fully discussed with your specialist when consent is being sought for the procedure and when its details are being explained to you. So make sure that these are important issues that are raised before you undergo the procedure. So just before we come to the end of the video, let's take a look at 4 questions that people commonly ask about UAE. Number 1 question, does it work? Well, the evidence indicates this, that UAE is a procedure that has a success rate of over 90%. Number 2 question that women tend to ask, is pregnancy possible with UAE? Good question. Yes, that pregnancy is possible after UAE, and there have been cases where women have gone on to become pregnant. If UAE is done very well, then really the blood vessels supplying the fibroids are the ones actually targeted by the procedure. So it targets the fibroids and less likely to target healthy uterine tissue, as one might expect if you're having myomectomies or other forms of surgery to treat the fibroids compared to UAE. The 3rd question that women tend to ask, what about sexual intercourse after UAE? There's no reason why a woman cannot continue to have a successful and happy sexual life after UAE. In fact, she might actually have an improvement in her sexual life because a lot of the symptoms associated with the fibroids have resolved. So yes, you can have sexual intercourse after UAE. And the last question that we get asked frequently about UAE is, can fibroids happen after UAE? And that's a good question. It is possible to a small degree, and let me explain why. The recurrence rate is low, that's the first thing to say. But fibroids can recur or regrow at any time, even after myomectomy. The other reason why it could happen in UAE is if the procedure was not properly done, or if there were very small fibroids when the procedure was first undertaken and then these fibroids have now grown. So it can happen, but the recurrence rate is quite low. So UAE has been a recommended treatment in places like the United Kingdom and the United States going back from the late 2000s. It has a very effective, very high success rate associated with less complications, less prolonged period of stay in hospital. The most important things that one should be aware of are that UAE should be carried out by a skilled interventional radiologist. So I think it's important for women to at least be aware that there is a condition, that there is an option like UAE that people may want to consider if they're not really keen or cannot have medical treatments or do not want invasive procedures like surgery and myomectomy or hysterectomy. UAE might be an option for them to consider. If you have any questions in this particular area or on this topic, please feel free to send us an email on info@askawayhealth.org. I'd also love to extend an invitation to you to join our community on Askawayhealth, where we provide you every week with newsletters and blogs on valuable health information and health tips. So it's also possible as a video of our community to request for a particular video on any topic that you want us to consider or to look at, and we'll be happy to do that for you. So please consider joining the community and helping us grow. You can do that by subscribing on www.askawayhealth.org, and I will put the links in the description section below. So thank you so much everyone for spending some part of your day with me. If you've enjoyed the video, please let me know in the comments, put helpful or liked, and don't forget to share this video with somebody who might find it helpful, a friend or family member. And I'd love it if you'd consider subscribing to the channel. That really encourages us to keep making videos like this and helps to grow our channel. So until next time I come by your way, have a great day, have a great time, and I will see you in the next one.